All right. Hello, everybody. So this review is for the day class and the night class. Uh, let's. I'm gonna go over some of it. I took the test. There's even a few that I missed, um, and only thing I've seen of the test prior to me taking it was putting it in the computer, and that was a copy and paste each question and each answer, so I didn't really pay attention to any of them. A few things I want to hit on before that. So, the test will be available Friday at midnight until, excuse me, until Saturday night at 11:59. Then it'll cut off. So you have technically 2 whole days to take it. Once you start it, you can't stop. As long as you stay logged in, it doesn't matter. But if you log out, that's your attempt. If something happens and your computer crashes or something unpreventable happens, you need to contact me or Billy so I can see if I can reopen it for you or something like that. So, but that would be the only way. So contact us early. Don't wait till the last minute. I'm gonna try to do a Zoom tomorrow. One for the day class, one for the night class. I will post that link in the announcement whenever I make it. The day class will be obviously during the day, and the night class will obviously be kind of towards the evening, probably around 6-ish. They will last an hour each, and it might behoove you to get on the meeting. Just going to throw that out there. I will be able to answer any questions. We might go over some more test questions. I'm not going to give you any answers to any of the test questions, so don't think that. But it might be worth it for y'all to log on to it. And if you don't, you don't. I've already got my EMT and paramedic, so it's up to y'all. This test, I did not make this test. I got this test from Billy and Gary. It has a lot of assessment questions, like primary, secondary, what you handle first, what you do first, what you are looking for on your secondary assessment, trauma patient versus medical patient. It had a lot of questions over that stuff. It has a lot of questions over shock, the different types. And it had a lot of pediatric questions. This test is a whole lot like the National Registry. It had a lot of the questions are written like the National Registry. There's a lot of wording in some of these questions, especially the scenario ones. This is one of those tests it's not timed, so go slow, take your time, read through it, read through all the answers. There might be 2 answers that you would think are correct. You need to pick the one that's the most correct. Go slow on it. Take your time. Like I said, as long as you stay logged in, it doesn't matter. On a test like this, it's 150 questions. I would break it up. I would do, 25 or 30 or 50, however many you can do at once. And then, like I said, as long as your computer stays logged in, get up, go get some water or a snack or something, or just get up and walk around the room, and then come and sit back down. The more questions you take up all at once, you'll start to get fatigued. I got fatigued on it when I hit about 70 or 80. So, even if it's just sitting back just leaning back and taking a couple seconds break to gather yourself. I mean, I like to take tests and stuff when I have music playing. That helps me concentrate. So you're taking the test at home, turn some music on. When I took this test, I had YouTube playing. So, you know, do what you can. I want y'all to do really, really good on this test. I think y'all can. We've been dealt a very crappy scenario with this COVID and then the classes getting canceled. I'm working with Billy every day. We are trying to find a way to get everybody together to do skills and to do an in-person national registry. So if we can make that happen, everybody will have to come, because if we can knock your skills out, you can test for national registry. And well, I take that back. You can be ready that way. As soon as we can get you in for the clinical portion, you'll be good to go. So if we can make it happen, please try your hardest to get there. And Billy has a national registry review that he will he will do. I believe he's going to be on the Zoom conferences tomorrow. So Friday, I can try to do one. I'm going to kind of see how shift goes. And Friday will be a day-to-day, or we'll play it by ear if we do another one. Saturday, I might try to do one. We're going out of town. We're going down to El Campo. So it just kind of depends on how the Wi-Fi is. And it might just be one big Zoom where how many people can get on that want to get on. So with that said, if you have any questions, if you're having trouble understanding something, please don't hesitate. Shoot me an email, shoot me a text message. Y'all should have my contact information. And if you don't, my number is 214-564-4939. Don't call me after 9 o'clock. If you need to talk and it's after 9 o'clock, shoot me a text. Let me know. Sometimes I go to bed early, especially on the nights or the days I get off duty. And I worked yesterday, so I did get a little bit of a nap, but typically I'll be asleep by 10:30. So if you need to talk, if you have questions, jot that down. If you text me, I might send you my email and say, hey, email me real quick. And then that way it'll remind me to respond. You might not get your answer right then, but I'll do my best to get you an answer. If it's after 10:30, good luck. If you're dying, call me 3 times and I might hear my phone. My wife will probably hear my phone and wake me up. So, just be courteous. All right, let's knock this out. All right, let's see. So, if you have 2 rescuers and you're assisting ventilations on an unconscious patient, one rescuer is compressing the bag while the other one is doing what? Are they holding the mask in place? Are they listening to lung sounds? Are they placing the hand on the victim's chest to watch for chest rise? Kind of know that procedure, know what each person's supposed to be doing. What's it called when somebody's laying on their back? So look up, you're going to want to know complex extrication and what type of incident might be a complex extrication. And I'm looking at it, and the answer choices, there's one that's obvious that you can knock out. And if you can do that on these tests, National Registry, all that, if there's an answer and you're like, I know that's not it, go ahead and mark it off. A lot of these tests I've passed because there's usually two answers that are completely wrong, then two answers that are close, and I pick the one that's I feel is the most appropriate. So that might help you out. Oh, there are several questions about heat stroke, exhaustion, um, dehydration. Uh, know the differences between those. Heat stroke. Remember, heat stroke has a real high body temperature. So look that up. You're gonna want to know that. I promise. That'll help you out a whole lot. All right. Know what the kidneys do and what are the kidneys unable to do when you're in end-stage renal failure. You'll want to know that. So if you have a avulsion of the upper eyelid, what are you going to want to do? Are you going to want to cover that with something hard and then cover the other eye with just a soft dressing? Or are you going to want to cover both eyes with a sterile dressing? Remember how we treat eye injuries and what you might want to do for that. Heat cramps. What are heat cramps from? Is that from fluid loss? Is that from what do you usually drink when you start getting heat cramps? And what's the reason you're drinking that? What are you trying to put back in? Here's one about so when you're doing this read, if you see something that's like lethargic, cool, pale, hypotensive, underline those or highlight them, whatever you have to do. Those are good indicators of what they might be asking. So that's and what type of shock those relate to. Is that going to be a compensated shock, a decompensated, or irreversible? So here's one I got wrong when I took the test, and I think I was just going too fast. If you have a MCI, what kind of command are you going to want to set up? Okay. And I'm going to double check that answer real quick. And it's not a unified. I'll tell you that. So remember, unified means you're going to have multiple agencies working together. So I give you a little help on that one. All right. Remember what you do with newborns. What's the first thing you do when they're out? You've got the umbilical cut. What's the first thing you do in the resuscitated effort? What's the most important thing you do with them? And it's not bagging them. You want to remember you're trying to stimulate them, trying to wake them up, whatever, and you want to keep them as warm as possible. That's one of your first things you're going to want to try to do. So keep that in mind. So routes of medication administration. I'm just going to give you this answer. So if it asks which of the following would be a internal route, remember that you can do. You have buccal, you have topical, umbilical, or intravenous. So, and remember that internal means anywhere along the GI tract. So, if you're wondering what that means, go find it in your book. The index is a great resource. I used it a lot when I was taking my paramedic test, when I was studying for it. Let's see. No, I don't know if we went over this a whole lot. We might have touched on it, especially with the day class because of having to get go to online. I don't know if we talked a lot about it, but you're preparing to call a radio report, and the hospital acknowledges that your presence and gives you permission to begin your report. What's the first thing you repeat to them? You're going to want to tell them something again and then start your report. Okay. Which of the following assessments are the most important when preparing or when performing the complete secondary assessment, the detailed physical exam? What's the most important thing you're looking for there? You need to know sludge, and if you have a patient with that is presenting with any of those signs and symptoms, what chemical or what might be causing that. Know your breath sounds. Know what breath sound correlates with the upper airway obstruction and a lower airway obstruction. So here's a shock question. No psychogenic shock. Really read the question. Look up the different types of shock. It'll help. There's probably more shock questions in here than there's a lot of them. So know those. So if you've got a patient that cut their hand off or let's say they cut their fingers off and they're afraid that they're super anxious, super worried, and scared that they're not ever going to be able to do anything again. What would you say to them to try to help calm them down? Go over lifting and moving. What do you always want to do before you lift something, before you drag something, before you move it? I know I went over it a million times with the night class about using your legs, not your back. So keep that in mind. Go over setting up a landing zone. This was a question on exam 8, and most of the day class missed it. I haven't seen the night classes exam 8, but most of the day class missed this one. So go over and go over what is important what are the components of it that us as people setting it up need to remember and need to look for. Let's see. If you have a patient that codes in the back of the ambulance, what are you going to do? You're going to start chest compressions, obviously, but what else are you going to do? So I know I hit on this with the night class. I didn't hit on it so much with the day class because we had to do it through video. But we've talked about resiliency, and resiliency also includes doing stuff to alleviate stress. One of the things I do a lot is I go to the gym. I have started and I continue to do some sort of exercise program, and that really helps me get rid of stress. So uh, keep go look up ways to alleviate stress in chapter 41. I want to say it's kind of towards the back of it, but I'm not sure. But that there's a question on here about stress and how we handle it and stuff. With patients with severe pneumonia, what's one of the principal problems for the body? Uh, know your PPE and uh, what would be the most appropriate for certain scenarios. These are common sense. You can read it, slow down, read it, and think about it, and that'll help you with the answer. So if you have a patient in respiratory distress, remember you don't always need to go straight to a BVM. Think about it. Think about how you would treat that. What's the most important thing you want to get? What's the most important thing to get started pretty quick and see if that helps? Remember, baby steps. Sometimes less is more. So here's another assessment question. If you're performing a secondary assessment in a focused exam, you're doing that because why? What's going on with the patient that makes you think that you can do that type of assessment over a detailed rapid trauma assessment or something like that? And why do we use a trauma patient assessment on every trauma patient? So here's another question that there's several questions like this on the test. What's a know your signs and symptoms of spinal cord injury. Definitely know those. Look up in the geriatric chapter. Common physiological changes associated with aging. It'll help you to know those. So here's another heat related question. Know the signs and symptoms of heat stroke. What are you looking for? What gives you that idea that they've gone from heat exhaustion to heat stroke? You know, there's a telltale sign that you're like, oh, we've just upgraded. This has just gotten a lot worse. So go look those up. You'll need to know those. Know your start triage systems. Know the red, yellow, black, green. Know what those are. So, on a cellular level, or here, I'll just. Which is true about diabetic patients with high glucose levels? Why is that an issue? Why is that a problem? So kind of go look up different signs and symptoms for different blood volume losses and what you could expect to see. Uh, yeah, look up how many. Yeah, just go look up that and the categories. Uh, so, how long do you want to stay on scene if you have a trauma patient that's showing signs and symptoms of shock? What's the uh, you have you have the golden hour, but that's to get them to the hospital and into surgery or treatment. But how long do you want to how long do you want your scene time to be? Um, Describe what the diastolic blood pressure and a blood pressure reading is. What is that? Go look it up. All right. Uh, Go look up PEs, pulmonary embolisms, and uh, what issues they cause. Why are they bad? Why uh, what are malfunctions that they cause? What's if you have a PE, what's not happening? So this question's kind of tricky. This is one of those you really got to read. But if you're doing something with a jaw thrust technique, there's a reason we're doing that and not a head tilt chin lift. Why are you doing that? What's the reasoning and what are you trying to do by doing that instead of the head tilt chin lift? If you can think of that, figure out the answer, that'll give you the answer to this question. Uh, Let me read them real quick. Yeah, that's what you're going to want to do. And you're doing that. I'm trying to think of a way to say it without giving you the exact answer. Uh, you're doing that on trauma patients, right? So on trauma patients, what are we concerned about? And what's one of the first things we do with uh, patients in car wrecks and stuff like that? So keep that in mind. Go look up the technique for the jaw thrust, why we do it, um, and the steps to doing it. Remember, most older people have kyphosis or some type of curvatures of their back, and be sure to pad those voids. Um, Elderly and young kids, you're going to want to pad backboards for young kids as well. Um, Go look up the word trending and examples of trending. Know what they're talking about when they say trending. Um, Look up muscular dystrophy uh, and the progression of that. What does it cause? What's it? One of the end results. The answer is not death. That's not what they're looking for. But what do what usually happens towards the end of that disease? Uh, let's see. Why don't we check for a pulse right after shot? Right after we shock somebody. How are you going to want to transport a patient with a abdominal injury or abdominal pain? What's probably going to be the most comfortable for them? Uh, so here's a question uh, over choking And what do you do with a and I underlined it, and this is what I'm talking about. When you read the question, you'll read it quick because I had to go back and check myself on it because I almost didn't catch it. But what's the difference between what you're gonna do for a responsive and unresponsive child? What's the greatest hazard associated with cave-ins during a trench rescue? Go look up trench rescue, and I'm sure it's going to be in that section, that area. Index again. No, here's another question over shock. Know your decompensated, compensated, distributive, obstructive shocks. Know all the signs and symptoms, all that. So here's one that you have a patient complaining of abdominal pain. What is a D&C? You'll want to know what a D&C is. D and C, not D&C. You're going to want to know what that means. This question, remember, we don't always have to transport every single patient. So if you have a patient that might not be in any apparent distress, and no other signs and symptoms except maybe like one minor symptom, we don't always have to transport. So keep that in mind. So on a BVM mask or BVM bag, we just crank up the O's. And if it has that reservoir on the back, remember, we want that to be full. We want to fill that up. So kind of keep that in mind. What's one of the findings when you're doing your assessment that you'll find that would be different, that would tell you, hey, I've got a fracture or a break versus a dislocation? You're going to need to know that for one of the questions. Remember, primary thing with newborns, like you catch them newborns, is you want to keep them warm. They lose so much body heat so fast. Keep them warm. If you have a patient that has had a stroke on the right side, you're going to want to put them on the right side. Because if you put them on their left and they have paralysis on the right, if for some reason you go to make a turn or something like that, they're not going to be able to like brace themselves. So keep them on the right side so that they can brace themselves. Every single question there. Again, there is a lifting and moving. Go look up how to lift and move, or how to move a medical bag. Remember, lift with your legs, not with your back. So, on this question, you're going to want to really read it, but think about what is considered sterile and disposable. So, and that'll help you. Don't read it too fast. Y'all haven't gotten to do a lot of write outs, but I'm sure y'all have seen that our OPAs just come in a big bag. And like the ones I have at my volunteer fire department, we just have them in a little case. And they can either be reused or you can toss them. I tell my guys, toss them. That's gross. But that might help you. So look up hospice care. Think about what hospice is. Is hospice just for the patient? Answer that. What is the Divers Alert Network? DAN. If it's on here, it's in your book. It's probably going to be somewhere around dive emergencies. Remember, if you have anybody that has a shunt or a fistula or whatever in their arm, we don't take a blood pressure on that arm. What does profoundly hypotensive mean? A lot of people, when I saw this question, a lot of people have gotten this one wrong too. Really think about it. If you're that hypotensive, your blood pressure is that low, what are you not able to do? What's the largest bone in the body? So remember, your license certification levels are EMR or ECA. They're the same thing. EMR, emergency medical responder. ECA is emergency care attendant. I think they just changed the name from ECA to EMR. But you have EMR, EMT, EMT intermediate, paramedic, or advanced EMT. EMT intermediate used to be, or is now advanced EMT, something like that. But remember, you have EMR, EMT, advanced EMT or EMT intermediate, and then paramedic. First aid provider is not considered a license. What's the proper technique to auscultate something? What's the proper technique in using the ears, the stethoscope? What does scope of practice mean? I already talked about that one. So somebody with high blood glucose, sometimes you can smell a certain smell around them. Look up. You might want to look that up. That'll help you with one of these questions. If you're at an MCI, what's the equipment you're going to want to bring? Remember, we don't work patients without a pulse at MCIs. Remember how to talk to patients, how to build a rapport. What's the most appropriate way to do that? Or what's a way that'll help you? Here's another PPE. Read the whole question. This question is talking about responding to a 18-wheeler rollover, and remember, if a vehicle's rolled over, we are not able to get to the vehicle. We're not able to get into it. So with this question, it'll help you if you really read your answers. It'll help you a lot. So know the difference in AED technology. Know the difference between biphasic, manual, automatic, and monophasic. Know what all those are. Know the different ways of heat loss. Conduction, convection, radiation. All right. Know how we tell a difference between a pneumothorax and a hemothorax. So there's one particular way, and I can't remember if I hit it in the night class or not, but there's a way that we can do it by thumping on the chest. Look up the different ways that we tell the difference, and that'll help you. Remember, our job with patients is we're also a patient advocate. We want to help patients, not just medically, but if you have a patient that is living in poor health conditions or, expresses, hey, I'm having a real hard time, I can't afford this or I can't do that. When you take them to the hospital, it's our job to relay that information and try to help them, try to get them help. So remember that when you're reading these questions too. All right, here's another shock question. Know your different types of shock. There's 5 of them. Know your signs and symptoms of them. You have anaphylactic shock, cardiogenic shock, hypovolemic shock, neurogenic shock. Know what your different types of shock are, and what you're looking for with them. If you're treating a patient that was just pulled from a house fire, or what are you looking for? What are you treating for? Obviously burns, but is there anything else that you're going to look for? What is an EMT's role? The most important role that EMTs play in emergency cardiac care, relating to a cardiac event. What do they want us, besides CPR getting started, what do they want us to do as soon as we can? Remember, if you're coming up on a hazmat scene, your safety comes first. So if you got people downwind that are laying out, if the cops want to go flying by, let them. But cops aren't hazmat techs. Okay? Keep that in mind. All right, and that's it. So tomorrow I'll try to set up a Zoom. I'll either send out the announcement tonight or first thing in the morning. I'm thinking about 4 o'clock for the day class, and I'm thinking about 6 o'clock for the night class. That way it gives me an hour break to eat. But they'll last an hour. I'll answer whatever questions. Remember, this is front to back, whole book, comprehensive test. Look at those handouts. Go back over the PowerPoints. They're all on Blackboard. You have, you can't say you don't have access to them. So from there, I'll see whoever gets on tomorrow. I'll see y'all tomorrow. Remember, if you have any questions, shoot me a text. If you want to email me, my email is bmp0001 at dccccd.edu. It's my school email. So it's D with 3 C's, then a D again, .edu. So shoot me an email. I'll check that before I go to bed. I'll check it in the morning. Usually I check that twice a day, once in the morning, once in the evening. Maybe after lunch if I think about it. Texting me is the easiest way though, if you want an answer right away. All right. Thank y'all. Have a great night, and hopefully I'll see most of y'all tomorrow.